Hello, this is Dr. Nairn, and this is our third section of the Immune Boost videos. And in these videos, we are going to talk about some vitamins. Nutrient deficiency is the most common cause of depressed immune system. Most people assume that living in the United States, we don't have to deal with nutrient deficiencies. However, the opposite is frequently the case. We eat diet that is rich in macronutrients, proteins, carbohydrates, and fats, but we do not consume enough fruits and vegetables and other food groups that give us micronutrients such as vitamins and minerals. For example, more than 90 million Americans are deficient in vitamin D. Similarly, 25% of Americans are deficient in vitamin C. And we could continue like this with other nutrient deficiencies. I want to discuss the vitamins and other nutrients that are very important for our immune system, starting with vitamin D. Vitamin D is one of the cornerstones of nutrients important for immune function. Vitamin D is one of the cornerstone nutrients important for immune function. It affects multiple chemical reactions in the body and upregulates antimicrobial peptides. It enhances clearing of microbes, and it has also effect on T cell activation. As I mentioned above, more than 90 million Americans are vitamin D deficient. And just to mention that in addition to its crucial role in immune system, vitamin D is important for your mood, it is important for your bone health, it is important for your energy, and vitamin D frequently functions as an activator of DNA transcription, affecting reactions that in themselves don't really directly relate to vitamin D. Having emphasized the importance of vitamin D, my recommended dosing would be to take about 5,000 international units of vitamin D a day. This might seem quite a bit, but in my professional experience, even if you don't know your underlying vitamin D level, taking this dose of vitamin D will not result in vitamin D toxicity. However, I would recommend that you do not continue taking this dose for more than, let's say, 3 or 4 months without having your level check. If you do know what your vitamin D level is, then I would recommend discussing with your primary care provider appropriate dose of vitamin D. Another vitamin that is absolutely crucial for immune function is vitamin C. Vitamin C has been proven to be both antiviral and antibacterial. Vitamin C supports the function of white blood cells. It actually protects the white blood cells from the toxins those cells produce in order to kill viruses and bacteria. Lower levels of vitamin C result in a shorter lifespan of those white blood cell fighters. 15.7 million of Americans have vitamin C deficiency based on CDC data from 2016. Vitamin C is water soluble, and vitamin C levels drop during stress, infections, smoking, chronic intake of aspirin or oral contraceptives. I think that this is part of the reason that we are seeing such an extensive population with vitamin C deficiency. In addition, a large part of population eats less than 1 serving of fresh fruits per day. And vitamin C is destroyed by temperature. So anytime you are cooking with fruits and vegetables, vitamin C gets destroyed. Typical dosing of vitamin C ranges from 500 milligrams a day to 3,000 milligrams a day. After reviewing current literature, I would recommend starting at 1,000 milligrams twice a day. There is some variation in tolerance of vitamin C. Some people can develop diarrhea or nausea and should reduce the dose if that is the case, or you can take a buffered form of vitamin C, which is more easy to tolerate. There is caution indicated if you are on blood thinner, Coumadin, or warfarin. The metabolism of this drug is affected by high doses of vitamin C, and people that are on Coumadin should not take more than 1,000 milligrams a day, perhaps even better in divided doses, 500 milligrams twice a day. As for vitamin E enhances both humoral and cell-mediated immunity, and most sources recommend 400 to 800 international units daily. I think it may be better in this case just to improve your dietary intake of vitamin E. Vitamin E is abundant in nuts, seeds, and green leafy vegetables. And if you do that, you gain other benefits and supplementation may not be necessary. Deficiency in vitamin E is rare. And the last vitamin we'll discuss is vitamin A. Vitamin A is important to keep your mucosa healthy and to be able to remove pathogens. In addition to mucosal immunity, vitamin A is also necessary for activation of T cells. However, vitamin A can be toxic in excess, and I would not recommend routine supplementation unless you discuss it with your physician. Especially patients that may have wet macular degeneration should not take supplemental vitamin A, not because it's detrimental to the eye health, but because it competes with lutein and zeaxanthin, which are important nutrients for your vision. And all of those nutrients bind to the same receptor. Good sources of vitamin A are cod liver oil and beta-carotenes, so those are your nutrients found in orange vegetables such as carrots and sweet potatoes. So before we conclude this video, I would just briefly review. We have discussed 4 vitamins: vitamin D, C, E, and A. And the recommendation would be to take 5,000 international units of vitamin D, unless you know you're vitamin D deficient, in which case you should discuss it with your physician. As for vitamin C, I would recommend 1,000 milligrams of vitamin C twice a day, with the caveat that people that are on the blood thinner Coumadin or warfarin should take no more than 500 milligrams twice a day. Vitamin E deficiency is rare, and vitamin E is abundant in nuts, seeds, and green leaf vegetables. So perhaps increasing intake of those food groups may be sufficient for vitamin E levels. The last vitamins we discussed is vitamin A. I would not recommend routine vitamin A supplementation, but I would recommend increasing vitamin A by increasing intake in orange fruits and vegetables or cod liver oil. And this would conclude our 3rd session. Thank you for your attention.